I want to thank my colleagues. I think today shed some light on how we all collaboratively work together.
Everybody's got their niche to play, but everybody is united in taking care of that patient.
Hi, my name is Connie Nicastro Bowman. I am a nurse practitioner.
I'm Jay Wish. I'm an academic clinical nephrologist.
Hi, my name is Richard Lund. I'm a nephrologist in private practice.
Hey guys, how's it going? Good seeing you all.
You know, this is excellent.
I think it's so important to recognize the dynamic of very smart, talented people on the team playing off against each other.
And I think from my perspective and looking at the team approach, I am a big proponent that everybody's information that's provided to the care team is just as important as the next person's. When I look at how that team support motivates the patients, it's very important to me that the patients understand that it's important to ask questions. It's important to be a part of their success.
I couldn't agree more. I think the team-based approach really has helped us and helped manage our patients' different situations.
Auryxia is indicated for the treatment of iron deficiency anemia in adult patients with chronic kidney disease not on dialysis. Auryxia is contraindicated in patients with iron overload syndromes.
So these are patients who are not on dialysis. They have stage 3, 4, or 5 chronic kidney disease. Why is it so important to treat these patients with iron deficiency anemia for their low iron levels?
Well, it's important to identify anemia and also identify the cause of anemia, which in many cases is iron deficiency. So typically, based on the KDOQI guidelines, once patients are stage 3 or greater, we should be screening for anemia at least on an annual basis. And if the patient is anemic, we should be screening for iron deficiency.
Can you guys elaborate on how you prefer to treat iron deficiency anemia in that population?
That's an excellent question. With different oral formulations available, specifically ferrous citrate Auryxia, you've got a medication that's been FDA approved for the treatment of anemia.
If the patient, as I said, has moderate iron deficiency, I probably would go with Auryxia if they've had a history of intolerance to ferrous sulfate. I don't want to use IV iron. It requires a trip back and forth, or maybe more than one trip back and forth to an infusion center, depending upon which agent is used.
And it's effective. It certainly does. All the studies have shown significant improvements in the iron parameters on patients who've been on ferrous citrate for the treatment of iron deficiency anemia.
Common adverse reactions for Auryxia include discolored feces, diarrhea, constipation, nausea, abdominal pain, and hyperkalemia. Akebia Cares offers services to help make access as easy as possible for patients, including coverage research, personalized support, and prescription assistance programs.
We're doing the best we can to try to find a way to pay for Auryxia in that patient population. But if the patient, meets the criteria, then we pursue the Akebia Care option as vigorously as possible.
Akebia Cares really has been a wonderful program. Patients get approved, which is wonderful for them that they can get their medications.
They are extremely easy to work with, and so I am very thankful for having that support and them always being available.
I think it's been obvious that each team measure offers a unique and valuable perspective, which in the aggregate offer the patient the best opportunities for improving their quality of life and their outcomes. I'm proud to be a nephrologist, and I'm proud to be a member of this very, very exciting and valuable team.
Important safety information. Contraindication. Auryxia, ferric citrate, is contraindicated in patients with iron overload syndromes, for example, hemochromatosis. Warnings and precautions. Iron overload. Increases in serum ferritin and transferrin saturation, TSAT, were observed in clinical trials with Auryxia in patients with chronic kidney disease, CKD, on dialysis treated for hyperphosphatemia, which may lead to excessive elevations in iron stores. Assess iron parameters prior to initiating Auryxia and monitor while on therapy. Patients receiving concomitant intravenous IV iron may require a reduction in dose or discontinuation of IV iron therapy. Risk of overdosage in children due to accidental ingestion. Accidental ingestion and resulting overdose of iron-containing products is a leading cause of fatal poisoning in children under 6 years of age. Advise patients of the risks to children and to keep Auryxia out of the reach of children. Adverse reactions. The most common adverse reactions reported with Auryxia in clinical trials were discolored feces, 22%, diarrhea, 21%, constipation, 18%, nausea, 10%, abdominal pain, 5%, and hyperkalemia, 5%. Specific populations, pregnancy and lactation. There are no available data on Auryxia use in pregnant women to inform a drug-associated risk of major birth defects and miscarriage. However, an overdose of iron in pregnant women may carry a risk for spontaneous abortion, gestational diabetes, and fetal malformation. Data from rat studies have shown the transfer of iron into milk. Hence, there is a possibility of infant exposure when Auryxia is administered to a nursing woman.